Well, thank you so much for your time this afternoon.
Thank
Could you
you.
please introduce yourself and the work you do at UCI?
I am Kristen Kelly. I am a professor in the Department of Dermatology, and I'm also a faculty member at the Beckman Laser Institute at University of California, Irvine.
What's important to know about the disease conditions you work with and the treatments for those diseases?
So my subspecialty in dermatology is laser or energy-based treatments. And I use lasers or energy-based treatments for a variety of conditions. One of the most common that we treat is port wine birthmarks here at UC Irvine. There are many different treatments that we can do, but I think I'm going to focus on that one today because that is the procedure that you observed. Port wine birthmarks are a congenital malformation. So they're present at birth, and they're a malformation of the blood vessels that result in what we see on the skin, which is a pink, red, or purple birthmark. They are commonly on the face, although they can be found anywhere on the body. And they can be sometimes associated with syndrome, so where there are other things that go along with it, or sometimes they can just occur by themselves. One of the things we have to do when we see these patients is determine if they are likely to have a syndrome and if further workup needs to be done. If we do think that further workup needs to be done, we might refer them to, for example, ophthalmology or neurology. Even if we do that, then we want to discuss with them treatment options. In the current state in 2022, there is really only one treatment option for port wine birthmarks, and that is laser treatment. Over time, people have tried a variety of other things. Decades ago, people tried, for example, cutting them out or freezing them or burning, none of which worked very well, left really extensive scars. So those really are not an option. The only option, again, is laser therapy. Laser therapy works by the light is absorbed by a colored chromophore or colored structure in the skin. And in this case, it's a hemoglobin species, either oxyhemoglobin or deoxyhemoglobin. And it's absorbed by that colored structure that creates heat. The heat radiates out from the blood and it causes damage to the blood vessel wall. That damage to the blood vessel wall ultimately causes a clot. That clot stops the blood flow through the blood vessel, and then the blood vessel is slowly resorbed by the body. So the intent of these treatments is to remove the extra blood vessels that occur in port wine birthmarks that cause the pink, red, or purple appearance.
Wow, that's an incredible mechanism of action. Before that was figured out, so you mentioned there weren't really other procedural options that worked too well, aside from maybe excision, which is a little bit more radical.
And sometimes these cover, say, half of a person's face, so you can imagine that excision really isn't an option. Or even if it's a smaller percentage, but it's cutting into a person's face, leaving extensive scarring, which again is not going to leave a better outcome.
Right. And were there no other treatment options in terms of pharmacotherapy or other treatment modalities that could help lessen the burden?
There are not. There are no medications that treat port wine birthmarks. So there's no topical medication. There's no oral medication that anyone has found that makes a difference. We have tried in the past doing laser therapy and adding a topical medication, and some people thought that would help, but it turned out that none of them really helped significantly. There were some occasional case reports where things would help, but nothing that helped all people to a great degree. So we continue to look for that. Now, we do now know there are a variety of genetic changes that can occur that do cause port wine birthmarks. The most common is a change in GNAQ. And there are a number of groups across the country, ourselves included, who are looking at potential medications to target this genetic change. But as of this moment, we don't have one that is working. And so there's still a study undergoing.
And what have you noticed that has been recent, if anything, that has been recently improved in the surgical process?
So I have been working on laser therapy for 25 years. And over that time, we spent a lot of time to try to improve treatments. I would like to tell you we've improved them hugely. And I think we have made incremental differences. I'll tell you about a few of them. One thing is we treat the patients as early as possible now, and that does seem to make a difference. So ideally, if we see a patient in the first month of life, we'll start treatments because it becomes more difficult to treat them as the patient goes on. It's not totally clear why that is, but it may have to do with the fact that there can be more pigment in the skin with time, that the blood vessels can dilate with time, that the surface of the skin becomes thicker and harder for the light to reach the blood vessels. And also because infants have extra hemoglobin that we can take advantage of early on, which then goes away by approximately a year.
Otherwise, do you see any either current research you and your group are doing, or maybe other improvements that you would like to see in the future?
So we're definitely still trying to look at better treatments. So that I give you one example of something that we've done to improve it. There have been some slight changes in, for example, the devices that we use, but nothing hugely dramatic. And we have tried doing a laser treatment and then doing a medication, for example, the combination to see if that would be better. So far, we don't have one that has been hugely successful, but we continue to look for that. And I think as we now have more information about the gene changes and as we understand or looking to understand the pathways, we ultimately will have medications that'll be more helpful. There is also something called photodynamic therapy where you give a systemic medication and then you do the light in the area that you want it to have an effect. And that's used mostly in China, but also is a potential treatment not available currently in the United States, but something we've done research on as well as others.
That's amazing. And sounds like there's interesting work being done and more on the horizon.
Well, the truth is that, we do have this treatment and it does work, but it takes a lot of treatments. It's not uncommon for people to have 10, 15, 20 or more treatments. And even when we do that, you can have some recurrence, not going back to where you started, but some recurrence. And so there's definitely room for improvement to try to make it that we can have fewer treatments for patients, they can have more complete removal, and that they don't have recurrence.
And how long does a typical treatment session take?
It depends on the area, and it also depends a little bit on the patient. So, sometimes we're able to do it relatively quickly because the patient is comfortable, et cetera. Sometimes we'll do a little area, we'll do some ice on an area to, make it feel better and do another, continue on. And also some port wine birthmarks are very small. So it takes me a couple pulses of laser, 3 or 4, and sometimes I have to do over 1,000 or 2,000. So it can vary widely, but I would say most of the treatments take us between 5 and 30 minutes, approximately.
Well, thank you very much for your time. We really appreciate getting to hear from you and learn about the procedure and where it's going and how it's changed treatment for these patients.
Absolutely. Thank you for your questions.